So can you please describe what you see in this video?
Yes, I can see a child. He is an infant and being fed by the mother in the home setting, and he is well alert and well grown for his age. Seems like, and he is having this arching of the back symptoms just after the feeding, and so my diagnosis is Sandifer syndrome.
Any DD you want to keep?
Yeah, GERD with associated with GERD. Okay, so cosmic protein allergy, and it can be any infantile spasm. It can be any seizure disorder, recurrent aspirations.
Yes. So in this video, I can see a child who is on home setting. The child is average for age. It is an infant, well active, the child, and the caregiver or mom may be giving feeding. Just after feeding, the child becomes started some arching back, some abnormal movements. So in the top of my diagnosis, it is the case of Sandifer syndrome, and Sandifer syndrome usual age is 18 to 24 months. And the differential diagnosis I have to keep gastroesophageal reflux disease, cosmic protein allergy, hiatus hernia, infantile spasm, any new type of seizure, non-compliance of the previous seizure, pain from stiffness, straining from constipations, recurrent aspirations, cosmic protein allergy, acute dystonia, meningitis, encephalitis, metabolic. We can say DD because one doctor exams come rashes. He thinks that the rashes may be Hennesconin purpura or ATP, but he tell non-accidental injury. Then the examiner start taking non-accidental injury video station. Then he confirmed that it is NAI. But he
Ah.
passed his mind it come IHSP ITP. So think he NAI on the DD tell, then he got it. So suppose it is a Sandifer syndrome. What's history you ask?
Yeah, relation. I would like to ask about the onset course duration and relation to the feeding. And association with vomiting or no? Is it projectile or no? And the child is well or no associated with fever, weight loss.
Yes. So the history when we take, we keep our mind the DD we keep and the diagnosis. Um, History onset course in duration, what increase and what decrease. Okay. As usual, the first line relation of the feeding, like associated with vomiting, is it projectile? Then is he well thriving? What about his height and centile? Type of the feeding, is it breastfeeding or artificial? What type of the weaning? Because gastroesophageal reflux disease, sometimes there is, we tell that thick feeding take. Repeated any chest infection, recurrent ear infections, excessive salivations, any blood in the stool. So repeated chest infection, aspiration sometimes occur, and history of allergy or eczema, as cosmic protein allergy, you are keeping DD, any developmental problem for CP, because cerebral palsy commonly associated with Sandifer syndrome. Any chronic illness, history of any drug intake, history of any operation in early life, like diaphragmatic hernia or esophageal atresia, and perinatal history. So what examination you like to do?
Yeah, I would like to check for the airway, patency of the airway, breathing and circulation, perfusion, everything is fine. Then I would like to go for to check for hydration status of the child, vitals of the child, hydration status, skin turgor, and this urine output, everything is fine. Then I would like to go for this weight and height check of the child, plot him in the appropriate growth chart, and a complete neurological examination of the child and abdominal examination of the child,
So
and
examination I
chest
would
for
like to
any
do.
aspiration. Yeah.
Okay. So examination for Sandifer syndrome, first airway, breathing, circulation, vitals, hydration status which act like entry fontanelle, skin turgor, urine output, capillary refill time. Take the weight and height and plot them on appropriate growth chart. Then general examination for any skin changes, tuberculosis, neurofibromatosis. So in infantile spasm we keep. So tuberculosis, neurofibromatosis, skin rashes. Neurological examination, it is an abnormal movement. So neurological examination, chest and abdominal examinations, because repeated aspirations, gastroesophageal reflux disease we keep. What investigation we do?
Investigations for this 24-hour pH study, and upper GI contrast study, barium solo.
Very good. So we are doing 24-hour pH study, detects acid reflux episode only, 24-hour pH study, 24-hour pH impedance study, because detect the both acid and non-acid reflux episode. So only is a acid reflux 24-hour pH study. 24-hour pH impedance study, both acid and non-acid reflux. Then upper gastrointestinal contrast study or barium swallow. Video fluoroscopic swallowing study done by speech and language therapists. That is video fluoroscopic swallowing test study. Esophageal manometry and flexible upper gastrointestinal endoscopy and biopsy. Okay, what management you give this patient?
Okay, I would like to check for the first of all airway I would stabilize the patient by maintaining the patency of the airway, breathing, and circulation, hydration status. I would check and give the IV fluids if he needs. There are two kinds of treatment: non-pharmacological and pharmacological. Non-pharmacological is feeding, reduce small frequent meals will be preferred, and pharmacological treatment includes there's a proton pump inhibitors,
Yes.
yeah.
So for management, any video station will get. First, I will take the full history. After examination investigations, after assessing his general condition, hydration status, I will discuss with my consultant the child need admissions or not. Then there are for two non-pharmacological treatment and pharmacological treatment. Non-pharmacological treatment is that review the feeding history. Position is upright posture. Feeding history, then reduce the feed volume. If excessive current weight, small and frequent feed. So some overweight, overfeeding causes vomiting. Reduce the feed volume if excessive or current weight, small and frequent feed we give. Trial of thickened formula, right? Rice, starch or cornstarch. So thickened formula we are giving if family history of atopy, presence of eczema, pain on feeding. So we keep there is any atopy, eczema, that is. Then we give extensive hydrolyzed formula for 4 weeks. After that, if extensive hydrolyzed formula is not working, we are giving amino acid formula. Amino acid formula, if not respond or relapse occur, the breastfeed trial of cow's milk exclusion from the mother's diet. So cow's milk exclusion after that for 2 weeks minimum. That is food challenge test we are taking. Obese child, weight management, healthy lifestyle choices. Pharmacological treatment, treat the symptoms but does not reduce the number of reflux episodes. Trial Gaviscon, that is trial of L-Ginate. Gaviscon therapy for 2 weeks, then H2 receptor antagonist ranitidine administered for 4 weeks, proton pump inhibitor like 4 weeks, omeprazole, lansoprazole, esomeprazole, these are, and refer if no response on treatment, recurrence on stopping treatment. Then domperidone is no longer recommendation for children aged below 12 years. So domperidone not contraindicated, not given below 12 years. Surgical niche and fundoplication or jejunostomy. Theme I am involving consultant pediatrician, gastroenterologist, neurologist, dietitian, and salt. So I'm telling. First, I take the history, okay, and I will assess his general condition like ABCD. Then I will talk with my consultant that admission needed or not. There are some non-pharmacological and pharmacological treatment. First, pharmacological, I review the feeding history, upright posture I maintain. Then thickened formula or small feeding, I keep that. And I will start that family history or the child has any atopic eczema like cow's milk protein allergy. Then I will extensive hydrolyzed formula. Extensive hydrolyzed formula, but the child relapse occur or not improving, I give amino acid formula. After that, I will refer and cow's milk protein exclusions, healthy lifestyle. These are weight management if obese. Pharmacological is that I will giving Gaviscon for 2 weeks and then ranitidine 4 weeks or proton pump inhibitor or esomeprazole, lansoprazole, these are, and domperidone is contraindicated below 12 years. Remember, I keep in your mind and then refer to the consultant. Niche and fundoplication or genitourostomy is the surgical procedure, and the multidisciplinary team is that my consultant pediatrician, gastroenterologist, neurologist, dietitian, and salt. So this is all about Sandifer syndrome. Thank you. Okay.
Okay,
Can you please describe what you see in